Hearing loss is a common and sometimes debilitating problem. Some estimates say more than 50% of Americans suffer from some type of hearing loss. The good news is that hearing loss is often treatable. Today and At the Forefront, we'll speak with some of our hearing loss experts and hear from them about different treatments and therapies that are available. We'll also talk to them about when you need to see a doctor if you're concerned about your hearing. That's coming up right now on At the Forefront. We want to remind our viewers that today's program is not designed to take the place of a visit with your physician. Let's start off with having each one of you introduce yourselves and tell us a little bit about what you do here at UChicago Medicine. And we are doing our social distancing here that we do because of COVID. And so we've got people in various parts of the room. And Dr. Sevier, you're actually up at the desk here, so we will, you drew the short straw. So
of course.
We'll start with you.
My name is Dr. Josh Sevier. I am an audiologist at the University of Chicago Medicine. I am the clinical program manager for the Pediatric Hearing Loss and Cochlear Implant Program.
Great. And Dr. Hudson?
Sure. I am Jackie Hudson. I am a senior audiologist at the University of Chicago. I've been here about 6 years, and I work primarily with adult patients. I do vestibular testing, audiologic testing, cochlear implants, pretty much everything.
Great. And I'm going to start off, I read an interesting statistic last night that said that some statistics will say that up to or more than 50% of Americans are suffering from some type of hearing loss, which is a huge number, and it can be very debilitating for a lot of those folks. Tell us a little bit about the services here at UChicago Medicine, what an audiologist does, and just how important that is to people.
Yeah. An audiologist is a doctor that takes care of people with hearing and balance disorders. We diagnose and treat those disorders using a varying different methods, such as hearing aids, cochlear implants, and others. As far as people with hearing loss, it's one of those things that you can't physically see. So a lot of people that would benefit from seeing an audiologist don't necessarily pursue it because they may seem like that's their norm, or others may kind of live in denial of going to pursue help with their hearing loss. So having that audiologist there is just having an advocate in your corner to get you through and help you hear the best possible way you can in your environment.
You know, it's interesting you bring up that some folks will live in denial of this situation. And I think particularly older folks, they may have just gotten used to it, or it's a gradual thing, so they don't see, or they just think that's part of being old. But that's not necessarily the case, or it doesn't have to be.
It doesn't necessarily have to be at all. Like I said, there's some things where people, as it progresses slowly, they just think this is what I live like on a day-to-day basis, and they really don't have a reason to think otherwise. Most of the time when we have family members that notice the way people are hearing, when you're constantly having people repeat themselves, or not hearing conversations at all, that's when you should recommend to a family member that you have that it may be time to go see an audiologist.
And Dr. Hudson, is that a difficult conversation? I would imagine it is a difficult conversation to have a lot of times because people don't necessarily want to go see the doctor, but it can make a big difference in their lives.
Yeah, I would say one of the great parts about audiology is that you are really only improving communication. So you're typically delivering news and you can say, you know, you have some hearing loss, but here is how we can treat it. And sometimes it helps patients with memory, and it helps, just communication. It really helps quality of life. So it's a good, important conversation to have.
I would imagine it just helps improve relationships as well for a lot of folks. So what aspects of audiology do UChicago Medicine audiologists specialize in?
Yeah, we really run the gamut here. We see adult patients, we see pediatric patients. We do audiologic testing, so just kind of to support ENT staff and for people coming in saying, you know, I have hearing loss. We do vestibular testing, so we test for patients who have issues with imbalance or vertigo. We do evoked potential testing, so that might be children who cannot do a traditional test, might do some auditory brainstem response testing, and then some of that evoked potential testing we do on adults as well. We work with hearing aids and implantable devices, so bone conduction hearing aids and cochlear implants.
That's interesting. We're going to talk a little bit more about cochlear implants. I want to kind of share a little behind the scenes, I guess. Maybe it's not behind the scenes because it's people have seen it, but we did a pretty neat video you were involved with a couple of younger patients who had, I believe they both had cochlear implants.
They did.
And it played at one of the Chicago Sky Games,
It did.
which is, I thought was really cool that they did that. And it was neat because, you know, that's a life changer. That's a huge difference in someone's lives. And I don't know if you want to talk about cochlear implants, or just kind of what that is and how much of a difference it can make for folks.
Sure. What a cochlear implant is, it's a little device that is surgically implanted, and it basically, if we're losing our hearing, it provides access to sound that we're not previously getting before if we've lost our hearing. It is a process. I always like to tell my patients that it is a marathon, not a sprint.
Yeah.
So it's definitely not one of those things like you see on YouTube videos where everybody flips a switch and everything goes back to normal.
Yeah.
It takes a lot of work. It takes a lot of practice. And it helps having a great support system around you in order to help practice at home your listening situations. But it does open up a lot of sounds that people didn't really realize they were losing or didn't have. We hear a lot, did you know that air conditioners made sounds? Or I haven't heard the birds in years. And that's for an adult. I mean, for a child, I mean, a lot of them are learning how to speak. And we learn a lot of how to use speech and our words by mimicking the sounds of others. So being able to provide that sound for somebody to be able to engage better with their environment and their family and everyone around them, I think is a really awesome thing.
Yeah, that is just awesome, and it's neat to see the faces light up. And,
Oh, yeah.
and the you know, it's I just think that's so incredible, and they're actually the implants can be hooked up to a computer to make adjustments and things like that, right?
Absolutely. So the activation day, things are probably going to change quite a bit. So we program them initially, and it's a process. It does take some time. But as your hearing improves and as your access to sound improves, we have to change the way we program those processors as well. So what it is, the programming for them on the first day is definitely not what it's going to be 6 months from now. It's very unlikely, I would say. And we also work a lot with speech therapists as well. So if they tell us during a visit, well, we notice this person's not getting their S sounds properly or their M sounds properly, we can actually make adjustments on the computer to help accommodate for that loss and not having that access to those sounds.
Oh, that's fascinating. And Dr. Hudson, I want to talk a little bit about the role of audiologists with cochlear implant patients. We've kind of discussed it and touched upon it a little bit, but can you walk us through, you know, what happens and how that all works? I just think it's fascinating.
Yeah, so the role of the audiologist is really present. We're present from the start through the whole cochlear implant process. The candidacy for implants is really changing rapidly. So it's our job to know the candidacy criteria. So it used to be that if you couldn't use a traditional hearing aid at all and you were deaf, then you were an implant candidate. And now they're present for loss of clarity, single-sided hearing loss, viral hearing loss that suddenly happened. So it's our job to kind of guide the patient on whether a traditional hearing aid can no longer be an option. And then we will say, okay, let's talk about cochlear implants, and we can talk about the different manufacturers. We can help you schedule an appointment with the surgeon. Then we will help you, do an evaluation to make sure that you are a candidate. We can talk you through the different manufacturers, pick out the equipment, and then when the surgery is scheduled, we are actually present in the surgery to ensure that the internal device is functioning. 2 weeks after the surgery, we're there to turn on the device, to program it, and then to help provide resources like Dr. Sevier was talking about, such as auditory verbal therapists to help you really get off the ground running and make sure that that implant is doing the best it can. And then we follow you throughout, the whole lifetime of your implant use for adjustments and for hearing tests to make sure that everything is working properly. And we're just, a resource and a guide throughout the whole process.
And throughout the you said follow the patient throughout their lives and make adjustments. Is that something that are there a lot of adjustments that are needed, or is that, I'm assuming that changes probably as you age, as most of us have hearing changes as we age?
Yeah, the implant works a little differently in that typically you have a couple appointments up front. So maybe the first 3 months you're coming in every couple weeks. And then once you have a program, which we call a map, once that's pretty stable, then we pretty much follow you every year or so and just make sure that everything is working well. We don't need to make any adjustments to the map. We test you in the booth and just make sure that you're still doing as well as you were, and just kind of adjust as needed.
Makes sense. Dr. Sevier, I think when people hear surgery, they tend to get maybe a little nervous sometimes.
Of course.
Is this how significant is the procedure, and how long does it generally take?
It's changed a lot over the years from the beginning to now. It's not really a major surgery anymore. It's outpatient. You go home the same day, usually here for 2 or 3 hours. The process itself usually only lasts about an hour, hour and a half, depending on the facility and the surgeon. But usually you recover for a couple hours after you wake up and you go home the same day. And then we give time for the incision site to heal and recover. And then most of our patients come back within at about 2 weeks to have their cochlear implant activated.
So it's not actually turned on for a couple of weeks,
No.
just to make sure that everybody is kind of where they need to be.
Exactly. The processor that sits on their ear, we don't want that rubbing against the incision site, improving a chance there might be an infection or something like that. So we leave all of that off and just give your skin and your body time to heal.
So I am curious, when does somebody need to contact an audiologist? If you've noticed just some minor changes, or, I think a lot of people suffer from tinnitus or tinnitus, depending on how you want to pronounce it. I know there's a little bit of a controversy there.
Sure.
That may be something to talk about, or if you're just not hearing things quite as well as you used to. When do you actually go see a doctor?
My personal opinion on that is I think if you're having difficulty understanding the people speaking to you and your family members, it's better to have it checked out than not. Hearing can stay stable. If you do lose some hearing over time, it could stay that way forever, or it could progress and get worse over time. So I think if you have noticed yourself having people repeat things quite a bit, or if your family's starting to point things out, if you notice yourself struggling and having difficulty in background noise, or the consistent ringing or buzzing from the tinnitus that you were speaking about earlier, I would definitely recommend reaching out to an audiologist.
Great. Dr. Hudson, I know this may be a bit of a controversial area, but can we talk about over-the-counter hearing aids? Because I've been seeing commercials for these things. People have been talking about it. You see things online. Is that a positive? Is that a negative? I personally, it's kind of like getting glasses or things like that. I would think you'd want an expert to help you with that, but I'm just curious what your take is on that.
Yeah. So as of this fall, the U.S. FDA issued a rule that over-the-counter hearing aids are available for adults with mild to moderate hearing loss. What that means is that, now traditionally you need to go to an audiologist or a hearing aid dispenser. You need to have an audiologic exam, and within 6 months of that exam, you can go and you can be evaluated and fit with hearing aids. So it can be a long process for some people. And I like to think of, over-the-counter hearing aids, they might be like cheater eyeglasses, where you can go to a Walgreens or a Walmart or a Best Buy, and you can kind of buy a set of devices that you yourself will self-test, usually, through a smartphone app, and you can kind of set them up yourself. So the benefit of this is that, one, competition is always good for consumers. It might increase technology, it might decrease the cost, which would be great. And then, it's just increasing access to healthcare for these people who might have just a slight or a mild loss and are pretty tech savvy. They can, purchase these devices, fit them, and maybe they'll work out for them in some, situations. The downside is that there aren't too many people who fall into that category. And most people, by the time that they're really noticing that they're having some difficulty, they probably need to see, a healthcare professional and really have a full test and be evaluated for hearing loss that may be greater than mild to moderate. And so, the other side of this is that we've been seeing these devices, especially in the past week or so, roll out, and they're expensive. So they might run from $200 to upwards of $1,000 for an over-the-counter device. Hearing aids typically cost maybe $1,600 to $6,000. So it's expensive either way, but you may benefit if you're kind of in that range. You might benefit from a lower end hearing aid versus an over-the-counter device. So on the one hand, it is increasing access to hearing healthcare, and that's wonderful. Yep. On the other hand, seeing an audiologist for a full comprehensive evaluation might be the best way to go.
So we do have, I failed to mention this at the very start of the show, and my apologies, but we do have another guest that's going to be joining us here in just a few minutes, Michele Friedner, who is a patient here at UChicago Medicine. And so we're going to have her on in just a minute, but I do have one final question for Dr. Sevier, and I just want you to talk just kind of about the state of audiology care in the United States and your thoughts on that.
Absolutely. I could always think it'd be better. That's just me personally. I think anything could always be better. As far as quality of care from audiologists in America, I think is top notch. I really do. I think we could do more to provide access for folks when it comes to receiving that care. Right now, the way it works is if you want to go see an audiologist in particular, you have to have a referral from a primary care physician or an ENT. There are bits of legislation working through Congress right now that have been sponsored from both sides of the aisle that are looking at making to where that referral process is no longer necessary. So it's removing a barrier for patients to have that access. So what that would entail is right now, audiologists are generally considered allied health professional doctors. So if this legislation were to pass, it would change that designation in Medicare to limited licensed physician, which would mean that audiologists would no longer need a referral in order to directly reach out to their patients. I think anything personally that we can do to provide our patients more access to get the care and reduce barriers is a win for everyone. So while I think that our care in general is top notch, like I said, access to that care could always be better.
Yeah, I think that's a wonderful point. So we do have another guest that's going to join us here in just a moment. So we're going to take a quick break. And when we come back, we'll have Michele Friedner, who will talk a little bit about her journey here at UChicago Medicine with, I believe, a cochlear implant. So it's interesting stuff, and I'd love to get the patient's perspective on this. So stick with us. We'll be right back. All right, welcome back. We're lucky enough to have Michele Friedner joins us today, and Michele is a patient here at UChicago Medicine, and I'm kind of curious about your journey. When did it start? And tell us a little bit about your experience here at UChicago Medicine.
So I have a severe hearing loss, and I wore hearing aids for most of my life. And then when I was 34, I decided to get a cochlear implant. And then when I was 42, I decided to get a second one. And I got the second one here at UChicago, working with Dr. Hudson, who we heard from earlier. And it's been a very interesting and gratifying experience to work with her and to work with the rest of the team.
This is a pretty great team.
Yes, it's a wonderful team.
It's very impressive to see the work they do. So we're all fans. But tell us, I'm very curious about the sensation of having a cochlear implant. What that was like initially, when you had the surgery, then you waited a week or two, and they turned it on. What is that like? Can you walk us through that?
Yes, and before I do that, I just want to say a few things. So
Sure.
I think it's really important to realize that cochlear implants are a tool, just like any other tools. And Dr. Sevier brought up during his talk that we often see activation videos being played on YouTube in which you have a child who seems to start hearing again and everybody is so excited. But in fact, that child is not hearing, and I'm using quotes on purpose. That child is experiencing a sensation which then needs to turn into sound. And that process requires a lot of active work on the part of the child, on the part of the child's family, on the part of the audiologist, on the part of the speech and language therapist. So it's a whole process. It's a marathon, as Dr. Sevier also pointed out. And so I really want to foreground the fact that cochlear implants are not miracle devices. I know we often hear that. They're called that as well, but they are tools. They're amazing tools, and they're powerful tools, and they do really important work. Earlier, you asked about a return to normality, and I think it's really important to realize that, cochlear implants don't return us to normality, and they can produce normality, but I think it's really important to think about multiple normals, and for audiologists and surgeons and speech and language pathologists to expand how we think about normality.
Yeah. I apologize if I said, return to normality, because people are certainly normal that have hearing loss. That's a poor choice of words on my part, but that's not that unusual on my part. I apologize for that. But it's a marathon, not a sprint. It's not just a switch flipped and suddenly you're hearing everything. It takes a while and some adjustment and that sort of thing. So how long was your process till you got to the point where you were comfortable?
Well, I feel like it probably took about 6 or 7 months. I had the first implant as a benchmark to work from. And so it took some time. And I think with the second implant, I had more fun with it than I did with the first one, because I do think mapping is a very interesting process. You're sitting there hooked up to a laptop computer and you're trying to describe sounds that you hear using a very limited vocabulary that we have to describe sounds. And you're working very closely with an audiologist to create a map that works for you, that provides you with the input that you want, and that creates conditions for you to communicate in the way that you want to communicate. And that map can allow you to hear or not to hear certain things. I remember when I was a young mother, I had a small child. I was wearing my implant to sleep with, and I really wanted a map that would allow me to just hear my child crying. And my audiologist at that time and I talked a little bit about what that would mean, what that would look like. But there are ways that one can be creative with a map. And mapping in and of itself is a process in which you're creating a sonic atmosphere. And so I think that's a really interesting process.
Well, it sounds like you took a very unique view of it too, because you had you did this in 2 stages. So to your point, you kind of had something to go off of, and it really allowed you to experiment and find some interesting points that worked particularly well for you. It's a fascinating process. Tell us about the staff here and how they worked with you through that process.
Yes.
It's a pretty good group.
Yes. So Jackie has been really wonderful. Sorry, Dr. Hudson. Is that okay?
You can call them.
Okay. Okay, yeah. So Dr. Hudson has been really accessible in terms of being able to set up meetings quickly, and she'll often sit down with me and figure out what it is that's going on. Does my map need to be louder? Does it need to be lower? There's certain frequencies that need to be adjusted. I met with Michele, who is a speech and language therapist who specializes in auditory verbal therapy early on after I got my second implant. And she went through some sounds with me to make sure that I could understand and hear and also articulate certain sounds. And I've also spent some time in a sound booth also with Dr. Hudson and some interns here to see how my hearing has been improving with the new implant.
Oh, great. So Dr. Hudson, I've got to ask you, you've got kind of a unique patient here. You have somebody who's very curious and has also had a cochlear implant prior. So what was it like working with Michele as she went on this journey and all of the different adjustments and that sort of thing?
Yeah, working with Michele has been awesome. She is an anthropologist. She really understands just a lot about disability advocacy. She understands a lot about hearing loss. She understands about the whole cochlear implant process. So I learn a lot as well. I also worked with Michele a little bit earlier on in my cochlear implant experience when I had kind of more recently begun to work with them. And so she's just very articulate. And then, also when you have a patient like this, you end up learning a lot yourself, and just to make sure that they are really getting the map, the sounds, the experience that they need to be successful.
Yeah, when I would imagine working with another scientist, that certainly is a unique take on probably a lot of things. And I'm curious about, I know you've written a book, and I'm curious about some of your work just as far as looking at audiology issues around the world. And there are people obviously that suffer from hearing loss in a lot of different places. Can you tell us a little bit about your work and some of your observations? I'm just curious what you found.
So I work mostly in India, and I'm very interested in the experiences of deaf young adults and deaf children. So I wrote one book looking at the experiences of deaf young adults who do not use technology and who sign. And for them, using Indian Sign Language is incredibly important, and they want more people in the world to use Indian Sign Language, and they see that as the solution or a way for everybody to be in the world together. More recently, I've started looking at India's emerging cochlear implant market and looking at government programs providing cochlear implants to deaf children. And that's been really interesting. One thing that I've really learned is that audiologists and speech and language pathologists in India are greatly devalued. People look to the surgeons, and there's sort of a cult of personality around surgeons. And when when Dr. Sevier was talking about access to hearing care, it made me wonder about that in the US as well, because there's a way that it often seems that audiologists and speech and language pathologists are not valued as much as other medical professionals. Maybe I'm wrong about that. I hope I'm wrong about that, but that's just an observation that I've been thinking about. The other thing is, it's been interesting to see how there's been so much of a focus on cochlear implants as a fix or as a cure for deafness. And I think it's really important to remember that cochlear implants are one tool among other tools. Increasingly in the United States, signing deaf adults like myself are getting cochlear implants, and we're getting them because we want to think about communication more broadly, but we don't want to stop using sign languages, and we'd like more people in the world to sign. And I think that it's really important to hold on to that as well. And there's no reason why families can't do everything. That's really been my takeaway from my research, that everything is required. Everything meaning multiple modalities of communication, multisensory input, and multiple relationships between people.
It makes perfect sense. Just one more tool in that whole toolbox that people can use. Now, I am curious. During the break, we talked a little bit off camera about access for people, particularly on the south side of Chicago, but you've studied other cultures as well. And when we talk about healthcare disparities, we've talked about it. We've discussed it on the show many times. We've talked about cancer disparities. Dr. Sevier mentioned, again off camera, that the life expectancy for folks on the south side versus the north side, I mean, the disparities are glaring. It's decades, literally. But so there probably are disparities, I would imagine, as well with audiology. What are your thoughts on that? I mean, obviously you've studied it abroad, and you have probably pretty strong feelings. How can we be better as a society?
So this is a great question. Thank you for asking.
Sure.
And I will say, so I've recently been doing some research in Illinois and in other states looking at Department of Corrections policies around hearing aid and cochlear implant provision for deaf and hard of hearing incarcerated people. And so, for example, in many states, somebody who is deaf and incarcerated is only eligible to get one hearing aid, right? So if somebody needs one, they get none. If somebody needs two, they get one. And that is a fact in many states, And so this is a clear example of a disparity.
Yeah.
We can look at Medicaid and Medicare policies in the US, and we can see what hearing aid and cochlear implant coverage looks like through those policies. It's very similar to Department of Correction policies where people will only be eligible for one device and not two if they're adult. It's different if they're children. And so I think there's a major issue around provision of aids and devices. I should note that I decided to get my second implant after I realized that my insurance wouldn't pay for a hearing aid. So my insurance wouldn't pay for a hearing aid, but it paid for an implant, which is why I got an implant. I'm very happy I got the implant, but that is a fact.
That to me is just baffling that that wouldn't be covered, and your statement about only getting one, that also is baffling. I mean, we don't only half treat cancer, or we don't only half, if you have a broken leg, we treat the whole broken leg. It's very, very strange.
It is, and it's an interesting question of what does it mean to hear well enough? In a carceral setting, one can argue that one needs to hear very well. In carceral settings are often incredibly noisy. When I talk to incarcerated people, they talk about how noisy it is, and they talk about how they need to hear for their own protection, but they're not afforded hearing aids or access to audiological care in these settings. And so I think, again, it's an interesting question of in what spaces are audiologists and speech and language therapists valued?
Yeah, that's well, and again, it gets back, if you have vision issues, we're not just giving you, one lens. It's very strange.
Although there was a lawsuit against IDOC for cataracts, so they were only providing incarcerated people with one surgery. If they needed two, they got one. If they needed one, they got none. So similar
There's
logic.
some consistency there with the lack of service, I suppose.
Yeah.
Interesting.
Yeah.
This has been fascinating, and I would be remiss. I want to ask Dr. Hudson just if you have any thoughts to kind of wrap us up on state of care, particularly in the south side of Chicago. That's where we reside, and we have our facilities, and just in general, what do you think? It was kind of similar to the question I asked Dr. Sevier earlier. Your thoughts on audiology care just in general?
Yeah, I mean, there is always room for improvement in access to care. I think, audiologists, we are few, but we are, out here learning and trying to provide the best care that we can. I think insurance coverage cost is a huge barrier. I think the need for, referrals to see audiologists is a huge barrier. And on the south side, we see a range here. We see a lot of patients who maybe they might have Medicaid insurance coverage, which is not great for hearing aids. And so I would love to see these barriers, not exist for patients. I'd love to see the access to audiologists, the access to hearing aids, the access to communication and speech therapists really improve so that everyone has better quality of life, better communication ability.
Well, you all do wonderful work, and you were very interesting on the program. I learned a lot today, and I hope our viewers did as well. So thank you very much for doing that. We are out of time. A special thanks to our guests for being with us today, and a big thank you to those of you who watched. Please remember to check out our Facebook page for our schedule of programs coming up in the future. To make an appointment, go online to UChicagoMedicine.org, or you can give us a call at 888-824-0200. Thanks again for being with us today, and I hope everyone has a great week.